Hi, my name is Sally Eberhard. I'm a public health nurse here in Stanislaus County. I am a supervisor coordinator of 4 programs. I have been in the supervisor role for just over a year, and I have been a public health nurse in Stanislaus County for 17 years. When I graduated from San Jose State, I had my bachelor's degree and I also had my public health nurse certificate. My public health nurse certificate was not used until I became a school nurse, and that's when I first started to use my public health nurse certificate. And then after that, about 11 years after that, I also then became a public health nurse. The differences between an RN and a public health nurse is a public health nurse is more community forward. An RN usually works in hospitals and clinics. PHNs, you usually find this out in the community. My interactions with community members, when I was a case manager, we do home visits, and so a lot of our visits, I visited with youth, and so our home visits are wherever our youth would like to be. So we do schools, we do parks, we do coffee shops, we do parking lots, we do wherever the youth are comfortable. And that's the same with anybody, any of our clients. We meet them where they're at, and if they would like to come to our office, they can come to our office too. My primary duties as a supervisor are resources and support for the staff, but my role as a case manager is resources and support for my youth and to be their cheerleader. My average day as a supervisor is a lot of meetings, a lot of telephone calls, a lot of texting, a lot of interaction with the team, troubleshooting with the team, reaching out to different agencies. The most rewarding part of my job has to be working with people. The most memorable experience for me had to be working COVID. The community wrapped around us as we wrapped around the community. We were gaining knowledge, we activated, we were supported, we felt supported, we gave support. The advice I would give for nurses who'd like to investigate public health would be come to public health and shadow for a day or two. We'd be glad to have you. Resilience. People are resilient, and it comes in different forms, but it's there.